Guys, welcome to another episode of DarshanTalks. I'm your host, Darshan Kulkarni. I'm here with a guest of ours, Alec Burlakoff, and Alec is a sales guru. He's actually had significant experience in pharma. He also has a very interesting cautionary tale, if you will, and he's going to tell us all about it as well. He has written a book. I don't have a link to that yet, but I'm hoping to have that. It should be in the description once he's got it ready, because I know he's working with Amazon on something associated with it. He also has a Sales Academy program, which a link to it is attached here, and you should be able to see it on your screen. And he also has a 20-minute consult if you want to talk to him, that you can use this Bentley link to go talk to him. But before we get started, Alec, do you want to introduce yourself?
Absolutely. First of all, thanks for having me here. I greatly appreciate it and love the opportunity to address schools, universities, and students across the country. So sure, my name's Alec Burlakoff, and I've been in pharma for over a couple of decades. No longer in pharma. Had a monumental fall from grace, if you will. I did start off as a sales rep carrying the bag and worked my way up in my mid-20s to manager, then director, vice president, senior vice president of sales with numerous pharmaceutical companies. We had a tremendous amount of success. I was successful throughout my journey in pharmaceuticals, but at the end, I was definitely I fell victim really to too much success. But don't get me wrong, I am not claiming the victim here. My success was a direct result of unethical practices in pharmaceuticals, specifically a violation of the anti-kickback statute. And we brought upon us a tremendous amount of attention and scrutiny. We were the number one IPO in the country in 2012, actually rang the bell on NASDAQ. And that level of success, coupled with the unethical practices of marketing a Schedule II opioid, eventually led to my being indicted in 2016, and then a sentencing in 2020 for a 26-month prison term in federal prison there. So it's been a long, tumultuous ride. And for me, the only sense that I can make out of it is that that ride and journey is something that I should be talking about and sharing with others to ensure that people in my similar shoes don't end up in the same predicament. And the predicament that I ended up in was not only a miserable and humbling experience for myself and people that I love, but unfortunately it affected God knows how many people across the country in a negative, and that's saying it nicely, in a negative way. So that's a little bit about me, Darshan.
Well, again, thank you for coming on. I think this is a really important conversation to have because I'm a huge fan of commercialization and sales strategies and all of that good stuff. However, it's important. I teach bioethics. I think it's important to talk about missteps, and I think you have reached the pinnacles of commercial strategies and the like, and you have committed your own missteps, and you are now sort of talking to people about those missteps, which is awesome. Can we start by talking a little bit about your journey, which is you started off, you said, carrying the bag. What did you go to college for? What did you go to school for?
Okay, so my bachelor's degree was in psychology, and my master's degree was in clinical social work. In fact, while working my way through grad school, I worked at a private school as a phys ed teacher and was also coaching some basketball. And then when I finished graduate school, for a couple of years, I was a school guidance counselor. So my journey began before getting into pharmaceuticals. In fact, it was a high-profile private school, quite expensive, the tuition. A lot of affluent people there at the school. And that's where my journey began, because I saw a little bit too much of what money could bring, at least on the surface, and I wanted. And one of the parents there asked me what I wanted to do with my life. And I said, I don't know, what do you think? And he said, I see you in sales. And he was a physician. And he said, I write a lot of a particular medication. I think I can get you an interview. And I said, you get me the interview and I'll be there. And so that's really where my journey began. To take it a step further, what really kind of lit a fire under me was one day I was monitoring the carpooling, and there was a guy there in a Bentley convertible smoking a cigar. We had a non-smoking policy on campus, and I simply went over to him and said, "Sir, would you kindly put the cigar out, until you pick your child up and obviously get off campus?" And he took another puff of the cigar. He blew it in my face and said, "Petty rules from petty people." That really was the straw that broke the camel's back for me. That ignited a flame under me where I basically said, no, this is not the predicament that I want to find myself in for the rest of my life. And I am going to get on a journey where I'm searching money, power, and ultimately something that was propelled by greed, quite frankly, that led me on my journey.
So that's kind of interesting, right? I was on Twitter recently, and one of the things they were talking about was how social workers don't get the respect they deserve for a lot of the work that they do. They talk. These were social workers who were saying, "I wish I could just have the respect that nurses get or lawyers get." And I've worked as a pharmacist for 20 years, and I can tell you that for me, the amount of heartbreak a social worker goes through on a daily basis is I couldn't fathom doing that day in and day out. You started from that place, and then
I did start from that place. In fact, the job that I discussed with you just now, where I was working at the school, I wouldn't really define as a true social worker job.
Sure.
However, when I was going through social work school and working on my preceptorships, I was in true social work and did work at community mental health centers. I did work at the Center for Group Counseling, worked with very, underprivileged people who were suffering from substance abuse disorders, people who really were having a hard time making ends meet. That was true social work. So I got a taste, but more power to, and all the respect in the world to the social workers who went way past the taste and made it a life for themselves. Talk about respect. Yeah, I do have respect, tremendous amount of respect for people whom have made a career out of being a social worker.
Exactly. And what I find is fascinating about that is I would consider social work to be one of the noblest professions there is. And you kind of started down that journey, and some guy in a Bentley ruined that for you by basically just, I had to write that down. Petty rules for petty people. How much worse can that guy get?
Yeah.
But the question that comes to mind is, that's what made you go, and I have to ask this, did that make you go, I want to be like him? Or did that make you go, I don't want to be like him. I want to get away from people like him. So I'm going to go down that sales path.
Yeah, no, it didn't. My takeaway from that was, it was not, I want to be like him. My takeaway was that I would never be subject to treatment from people like him. That I would be, I would be respected, and that I would not be the target of someone's cruelty, anger, as well as insecurity. Because, I do know that people who speak like that, deep down inside are gravely insecure.
So now you got this interview, this physician at this very prestigious school connected you with some company, and they said, would you like to carry the bag? So,
believe it or not, my first interview, I didn't get the job. I came in guns blazing, but I got beat out by someone who already had been calling on those physicians in the territory with a competitor drug.
Okay.
So I was devastated, of course. I thought this was my shot. But by the time I had gone through that process, I had decided this is what I want to do. And the person who interviewed me, and I didn't know if she was being truthful or not, but she turned out that it was truthful. She said, I really like you. I definitely think we have what it takes. I can't give you this job. This guy's just overqualified. But I'm going to keep you in mind for something else. And sure enough, a few months later, she called me and I did take that job.
It's funny. You remind me of that story from Hamilton. I don't know if you've seen the play, but I'm not going to lose my shot. And that's really what you kind of dealt with. So you landed up in a scenario where you missed the first shot, but you got another chance at the free throw line, and you kind of nothing but net. You got in. If you knew anything about me, you'd realize how ridiculous I sound because I know nothing about sports, and I'm really hoping I got some of those words right. But
you got it right. I used to coach basketball, and when you said nothing but net, I'm like, I like that. I'm going to use that. That's great. Yeah.
That's awesome. Yeah. Okay. So now you're obviously what I know about you is you're now in the sales role. You went high up the food chain. So this was several years ago. Is that fair?
What, the indictment or?
No. The your first role in sales.
Oh yeah, it was in like 2000. Yeah, so
okay,
over 20 years ago. Yeah,
over 20 years ago. So you're talking about the heyday of pharmaceutical sales. You're talking about all those programs that pharma is still digging its reputation out of. When we talk about, could we talk before we get into some of those programs? Could we talk a little bit? Sorry, before we get into where we are today, could we talk about what that was like? Because I come at these things from a compliance promotional aspect, and what I start thinking about are those gas and dash programs, and I talk about those trips to Maui, and all those things that were sort of overkill. But this is what compliance heard. This is what compliance sort of came in after. I was still a pharmacist when this stuff was happening. I wasn't even a lawyer yet. So I want to hear from the proverbial horse's mouth. Talk to me about those days. What were you guys doing? What were you guys seeing? What were you guys expected to talk about? What was that journey like?
Right. So those days were, for a salesman, for a true salesman, were heavenly. Those days allowed the relationship, which is so, often talked about in any type of sale, right? Got to have a relationship, got to have a relationship. Those days allowed you to actually establish a relationship. A lot of times we talk about relationships with salespeople now, and we talk about it because it makes sense, but it's actually not a reality. A lot of sales now is done just like we're doing, like via Zoom and on phone. And, you and I could establish some sort of rapport. I feel like we already have, but nowhere near the type of relationship that we would establish if we were on outings, literally on a daily basis, whether it be golf or trips or private jets, or, adult entertainment clubs. I mean, all of these things took place. And it was for me, it worked. That's who I am. I've always been a guy who has been social and been very comfortable in those types of environments. So, that's part of the reason why I was as successful as I was. I was rookie of the year at my first company. I mean, I won every award. I was the top rep at every company I ever worked at. But that's how I did my business. I didn't do business calling on physicians all day long, standing up in the middle of the hallway with my little pad for them to sign for samples, delivering a 30-second sales message. I knew that back then that would not get me to be number one. I knew that I needed to spend my entire day, week, month, or even year with a handful of customers to establish a relationship that was so strong that I could get whatever it is I needed or asked for. In fact, more times than not, our relationship was so strong, I didn't even have to ask or close. They actually would close for me and say, hey, Alec, what do you need? So things were quite different back then. I will tell you though, Darshan, there's a place for that in sales. but there isn't a place for that in pharmaceutical sales, because we're talking about human beings, we're talking about patients, and we're talking about influencing prescribing habits based on a relationship that could directly affect a human being's livelihood, their health, their future, and so forth and so on. And I realize that now. I realize that because I learned the hard way, a very hard way. Now, again, not just because of what happened with me. I'm not talking about what happened with me. I'm talking about what happened to patients. And so ultimately, the extreme example of where relationship-based selling does not belong in pharmaceutical sales, the extreme example is with Schedule II opioids, right? Because the dangers and the risk associated with Schedule II opioids far exceed probably any other medication on the market today. Arguably speaking, maybe you could put in benzodiazepines as high risk, Schedule II, amphetamines and stimulants, but still, in my opinion, the opioids the risk far outweigh anything else in the market. And I will tell you that even though you say 20 years ago was the heyday, I will tell you that in 2012, when I started with this company up until 2015, we were utilizing those exact same principles. Right then. Yeah, absolutely. So a lot of people, someone wrote a book, The Hard Sell by Evan Hughes, on this story. And he used an analogy that, the speed limit is 65 and everybody drives 75. So everybody's breaking the law. But Insys, they were driving 90. And because they were driving 90, they were basically, held culpable, right? They were indicted and they paid consequences. But we're in an industry, quite frankly, where no one follows the guidelines. In some way, shape, or form, the guidelines are being broken. And now it's just come down to what extreme are they going, and who are the far outliers that we're actually going to go after and perhaps make an example of.
So, and I really want to get to that question, but I kind of want to follow that journey a little bit, because to me, we're still in the early 2000s, maybe late 2000s. You're telling me that we're moving away from relationship. Well, we're still sort of in the heart of relationship-based selling, and you're telling me it works really well from the perspective of doctors writing scripts. They're doing the closing. I remember 2009 or so. You start getting things like the Sunshine Act. You start getting things like the Pharma code, which comes out and says you can't be giving gifts away. And you have all these trainings and these sales reps are going through this training stuff. Talk to me about how that was received from the perspective of the sales folks. Because obviously as compliance, they tell you, oh, this is great training. We've learned our lesson. We're never going to do this again. But everyone knows from an intellectual standpoint, that's what I want to hear. That's what you're telling me. What was reality like in the field?
Yeah, these are great questions. I mean, I've done several podcasts and different lectures, and I haven't been asked questions in this exact way. The fact of the matter is that any true sales rep is miserable, right? They're in an uproar. This is the last thing they want, because the fact of the matter is business is done across the world in all different types of sectors based on relationships. That's what makes the world go round and round. That's what makes things happen. I mean, look at politicians. I mean, look at how most business is conducted. It's done on the golf course or in some way, shape, or form. I don't play golf, but I'd fake it, until the physician got frustrated, and then I just said, all right, I'll meet you, inside for lunch. But that is how business is done, and you cannot argue that. So in pharmaceutical sales, when they started to say, we're going to still expect you to meet quotas and goals and allow us the opportunity to put this money towards research and development, but we're going to put these restrictions in place for good reason. The reps were like, all right, where do I find a company that's not enforcing these rules and regulations? That's basically what happened. And what we found was The larger companies, and again, I don't know this for certain, I'm just speaking in general terms. The larger companies, such as a Merck or a Pfizer or a Johnson & Johnson, you would assume that they would enforce these guidelines in a stricter manner. And then you would also assume, and the assumption was, that the small startup biotech companies with maybe one drug to market would be less likely to enforce these rules and regulations. And that's where your top reps would go to. They would flock to, including myself. I mean, I made a promise to myself that I would never work for a large company again after I left Johnson & Johnson, and I never did. And so it's an oxymoron. There's a paradigm shift. It doesn't work. You're asking people who are career salespeople who know how business is moved and done to work in an industry where it is unacceptable to move business in that manner. In fact, if you go back to before I was even around, Eli Lilly, back in the day, they only hired PharmDs and RPHs to sell their medications. They had it right. Unfortunately, and I don't know why they switched, but unfortunately they started to hire anyone with a college degree to sell, probably because they realized that other companies were not as stringent with the credentials that someone needed, and they were moving a ton of business, right? So there's that push and pull going on, and it will always go on. For me, I take a hard stance now that anybody with a Schedule II opioid should not and could not have incentives, commissions, and bonus dollars, quotas aligned with their salespeople. Because as long as you have that carrot dangling, you are running the risk of someone doing something that could be controversial or even worse. And ultimately, the one who will pay the price would be the patient.
So what you're describing is people giving compliance sort of the proverbial nod and saying, yes, great, thank you, but we'll be taking our business elsewhere. We'll be going somewhere else where we can still do what we need to do, because these startups either don't have the infrastructure, they don't have the programs, or quite simply don't care. Just so you know, at Insys, my first year there, we didn't have a compliance department. We didn't even have any inside counsel. Right. And so it's kind of interesting to think that what I thought was the greatest thing in the world for me, what I thought was fantastic because it was the wild, wild west and I could do whatever I needed to move the business, turned out to be, in my opinion, the sole reason why I was indicted and ultimately incarcerated. Had they had a compliance department in place, had they had, rules, regulations, and guidelines that were strongly enforced, that I needed to adhere to, my entire life would have been different. The worst thing that would have happened was I wouldn't have hit my sales goals, which is probably likely. And I would have either been fired or I would have had to go to another company. In comparison to what really happened, that would have been a blessing in disguise, right? So you now were in a situation where you were saying, I'm in Insys in this case, and we can talk about it because they were indicted. There were penalties and fines and jail terms and all that good stuff. But talk to me a little bit, because you mentioned the use of PharmDs for selling. One of the key pieces that I talk about, and actually you mentioned, I don't know why they don't do the PharmD thing anymore. I actually landed up writing with a friend of mine a 42-page article on off-label discussions and what are the limits associated with that, and how does medical affairs play in with sales. But I've spoken to companies, to medical device companies, to large medical device companies who essentially take the position that I can work in conjunction with the sales department, and medical affairs and sales can work together to raise awareness of the product. Can you talk a little bit about your relationship with medical affairs? Did you see them as another tool in the sales arsenal, or did you see them as a completely different piece that was separated by a Chinese wall? What was your perspective? Because you were high up the food chain at this point.
Yeah, it depended on the company.
Okay.
And it also depended on the individual that you were assigned, right? So I do remember, being assigned a medical liaison, and, say there were 5 of them with the company, we would know that John Jones, that's the one you want, because when he gets out in the field with you, he's going to be very aggressive in talking, where this medication could be used off label, which is a huge opportunity for the sales rep to hone in on and then cash in on as far as commissions and bonus dollars. There's other medical liaisons that are much more strict in what they can and cannot do and what they will do. Oftentimes a medical liaison will ask the healthcare provider for an opportunity to follow up with them, one-on-one, where the salesperson is not there observing, which I think is much more ethical, quite frankly. When you have a sales rep who is not supposed to discuss anything that's off-label, not FDA approved as far as indication is concerned, but they're in the same room and in the same conversation as the medical liaison, you're really pushing the boundaries there. But I've seen all shapes and sizes. I've seen companies where we could literally get the medical director, the liaison on the phone almost any time, where they would pick up and literally just engage in an off-label conversation. There's got to be something wrong with that. I think that's an area that is actually very subject to abuse, and manipulation. Now, if a company were to go to literally, here's the thing: say they abolished all sales reps with just college degrees, masters, or even whatnot, and went with RPHs, right? Mm-hmm. One of two things is going to happen. The RPHs are going to stay ethical in every way, shape, and form because they have something to lose, right? They have credentials. They have a license to lose. Or the incentives and the carrot that's being dangled is going to be so great that they're going to literally abuse their power to the nth degree and promote more off-label than we've ever seen in our lives. Right. So there's a risk there as well. And again, I just think in the end of the day, it's always going to come down to the person and their own moral compass. And I talk a lot about myself. I really didn't have much of a moral compass, for a long period of time, which is why I was the perfect hire at Insys. I was a great target. I was a target. I was a mark. They saw me, this young, hungry, passionate guy in the interview who basically said he'd do anything and everything to get the job done. And that's exactly what they wanted. And they knew that I would cross all lines and that there would be no limits or boundaries for me. And based on their goals and aspirations, I was the perfect fit. So, things went wrong in a lot of different ways.
Alec, we're already well past the time that we'd allocated, but we obviously have a very, very interesting subchapter of your life so far that I'd love to get on. Would you be interested in coming back?
Sure. Yeah, just let me know.
Absolutely. So here's a question for you before we go. If people want to reach you, what's the best way for people to reach you?
The best way to do it is just to email me at training@aburlakoff.com.
Awesome. And this is actually part of your training program, isn't it?
Yes. It's associated with, I will, if you want to book, there's a plethora of ways we can go, but it all starts with an email. I could give out my number, but that might get a little bit crazy. But yeah, I'd love to talk with anyone in any capacity who has an interest, good, bad, or indifferent. Look, I know there's a lot of people out there that have someone very close to them that has fallen victim to the opioid epidemic and pandemic. And I am very, I can't tell you how apologetic I am and sorry. And, I'm open to any and all criticisms that comes along with my involvement there. But I'm also very eager to do good with my experiences and the knowledge that I've gained as a result of these experiences. So any way I can help, whether it's just being a sounding board or a punching bag or actually being a resource, I'm definitely open to that.
Awesome. And stay tuned. We'll be talking further again with Alec, because we're then going to talk about his journey with Insys and hopefully talk a little bit about his experiences there, what he's doing now, and how all of that's changed him. So stay tuned. Alec, thank you again for coming on the first time.
Thanks, Darshan.